Hello everybody. Now we are here with a cancer prevention seminar, lesson 11. And we are going to talk about pancreas cancer. Pancreas cancer is a very severe disease. Not because it's severe, but because it's hard to find. It's hard to have a test that you can do. It's hard to have a symptom, and mostly when a person has a symptom of this cancer is because it's too late, because the cancer is already developed. That's the problem with pancreas cancer. My secretary was depressed one time when I was working in Hong Kong, and then I asked what was wrong, and she told me that her mom was diagnosed with cancer. And I asked her back, what kind of cancer? And then she said, pancreas cancer. And she was asking, is there anything that you can do, or a diet change? Because she knew that I work with prevention and I was doing the cancer seminar. Or is there any treatment that I can refer her to? And then I told her, sorry, this is one of the most aggressive cancer that I've known of. She might have just a couple of months of life, so you better prepare yourself and your family for that. It's kind of tragic, I would say, but we have, as doctors, we have to prepare people for things like that, because this is mostly what is going to happen when they found a diagnosis of pancreas cancer. I think I've seen a person, the most that I could heard was a person that survived 2 years of this cancer. So she died in the following month. So it was faster than we thought. Where is the pancreas? The pancreas is in the central abdomen. And then it is below the stomach, I would say behind the stomach and below the liver. So you see in this picture that is not even easy to find if we have to do an X-ray, by instance. It's an organ that is hidden in the abdomen. What does the pancreas do? The pancreas have two functions. One is endocrine, the production of insulin. That is important to prevent diabetes type 1. Diabetes type 1 is the one that happened during infancy because there is an autoimmune disease. But we don't know very well yet, but we know that there is a destruction of this endocrine part of the pancreas, mostly the beta cells of the pancreas, that will not produce insulin anymore. So this person with type 1 diabetes must need to take insulin injections or insulin for the rest of their lives. The type 2, however, is related to not to the production of insulin. It's not a pancreas problem, but it's a problem with the cells outside that are resistant to insulin. It becomes a problem because the pancreas will secrete more insulin trying to get to the cells, and then it got to a point that type 2 becomes type 1, mostly type 2 diabetics that are very old or very ancient in the disease. And the exocrine part of the gland, by the way, pancreas is a gland, produce enzymes that help the digestion of foods, that the amylase to digest starch, the proteases to digest protein, the lipase to digest fat. Here you have the rates of pancreas cancer in California for Hispanics and non-Hispanics, and for female and male, for you to have an idea. The disease is more common among blacks, and that's the important figure in this picture here. And it looks like male and female, there is no much a difference on this one. The yellow column is whites, and then for whites we have higher risk of pancreas cancer among men. And then I would say that in at least for whites. For blacks, the difference is not that big. By the way, the risks in California are similar to the risk in the country. It's a rare cancer in Africa and in Asia and in undeveloped or developing countries. 95% of the types are adenocarcinomas that are the exocrine part of the pancreas, the ones that produce those enzymes, the digestive enzymes. The endocrine is related to diabetes. Is more common in men, as we mentioned before, is mostly fatal when diagnosed. The survival in 5 years is 4%, is the worst survival that we can have in terms of cancers. And there is a relationship with smoking and a high risk of diabetes for diabetics and those with metabolic syndrome. There is a family history. So if you have mother, father, sister, and brother with the cancer, you might have a predisposition for the disease. By the way, we always advise people to check their family history for all disease, to know if the person has, like in pancreas cancer, if you have someone in your grandparents that have the disease, you might have a higher risk. So if you have pancreas cancer, if you have diabetes, and then you have a risk of those diseases. In general, this is the best way to know if you have a risk for something. For you to prevent the disease to occur, you start doing the lifestyle that are preventable for those diseases, or avoid the risk factors of disease. So in the case cancer, diabetes, and heart for a person would be first to do the screenings for that more periodically. Second would be to increase the diet rich in fruits and vegetables, decrease animal foods, increase vegetables in the diet and fiber, and increase exercise. Those are preventable things for those three situations. The symptoms for the disease might be dark urine, pale stools. You see stools that they don't have any color, or the skin starts becoming yellow, or jaundice in the eyes. This is because the pancreas is already blocking the canals. This is because the pancreas is blocking the conducts from the liver to the gallbladder and outside of the body. So if the cancer, the tumor, block this, will accumulate a lot of bile acids, and then will cause you to have bilirubin increase in your system and your blood, and then will affect the skin and the urine and the stools. Pain in the middle part of the abdominal or in the back that does not go away. nausea and vomiting and stools that float in the toilet. But again, this is some of them can have those symptoms, but mostly those are very advanced symptoms. So now we have another video to illustrate this. I'm going to show this video for you.
Well, cancer is really cells growing out of control. So when a cell grows in an organ, it's controlled by the organ. It's told what to do. It says, you're part of the liver, you should develop into a liver cell, and this is what you should be doing. Similarly, in the pancreas, you're supposed to be a pancreas cell, this is what you do. But in a cancer, the cell develops a mind of its own and just starts to grow out of control, out of organization with the rest of the body. And because it really isn't influenced by the rest of the body, it just continues to grow. It doesn't do anything useful, and just simply through growing, bits breaking off and spreading and growing elsewhere, it replaces and consumes those organs that we need to survive.
The pancreas is an organ which lies at the back of the abdomen. It passes from here across to here. It's shaped a little like a fish with a head, body and a tail. It lies in the duodenum where it produces pancreatic juice. It has a beautiful orangey yellow colour to it, and it's soft, yet it is a very powerful organ because it makes enzymes which digest your food and also makes insulin to help you metabolize that food that you've digested.
Pancreatic cancer is usually a single tumour which originates in the pancreas but then can spread elsewhere. It can either spread to the lymph glands close to the pancreas, which we can still take out with an operation, or it can spread to the liver or the lining of the abdominal cavity called the peritoneum.
The important cancers of the pancreas are called adenocarcinomas, which means they come from the duct cells of the pancreas. And these cells arise in the ampulla or the opening of the pancreas, but mostly along the main duct of the pancreas. They tend to, for some reason, be able to grow more quickly and to migrate more quickly than most other cancers in the body.
We found 2 big tumours in my liver, which were the size of a tennis ball. And so we decided to do a biopsy after that. And after the biopsy, it was confirmed, yes, that I have endocrine carcinoids and that I have cancer, which started with the pancreas being the primary and metastasized to the liver.
So this mode of spread is called metastases, which means moving to a different site. And so individual cells of the tumour shed off and they lodge in other organs such as the liver, and then they continue to grow. And so whilst it is still pancreatic cancer, it now is in the liver. When we diagnose somebody with a pancreatic cancer, in order to decide what sort of treatment we're going to do, we have to do what's known as staging, to identify which stage the cancer is at. Is it as an early stage? Is it confined to the pancreas? Can we do things like surgery? Is it a little bit more advanced but still in the area of the pancreas, which means we can't do surgery, but we can use other things?
For patients who have a locally advanced non-resectable cancer, we usually give both chemotherapy but also give radiotherapy throughout the treatment.
Or has it already spread somewhere else like the liver, where neither surgery nor radiotherapy is really going to help, because just taking out the origin of the cancer isn't going to help because it's already spread. And so in that instance we use chemotherapy.
When Mum was first diagnosed, she told me that the doctor said she would only live for about 2 weeks, and and she was in absolute shock because she said, I didn't even feel sick. And then once they looked at further tests and scans and things, they were able to see that the tumour hadn't spread anywhere else. So they said they modified their prognosis to about a year. And as it turned out, Mum lived for 3.5 years, and she lived pretty well for most of it. She had a reasonable quality of life.
Generally with pancreatic cancer, it's got a bit too far by the time it's found. But they could have told me, yes, you can beat it. It is possible. It's not necessarily a death sentence. I was 50 and being told I'd be dead within 6 months. And I just wasn't prepared for that.
Actually, when I first told my boss that I had cancer, she really couldn't believe it. She said, "You are one of the fittest person in the office. You know, all the other young men, they fall down like flies."
Unfortunately, the main risk for pancreatic cancer is bad luck. We don't really know enough about most of the cancers that develop. They just develop for a reason we don't understand. We do know that about a quarter of pancreatic cancers probably develop as a result of smoking, and smoking is certainly a risk factor. Another risk factor is pancreatitis, or more specifically chronic pancreatitis, which is an ongoing inflammation of your pancreas. We know that diabetes is associated with pancreatic cancer, but it's not necessarily a risk factor. It may be something as a consequence of the pancreatic cancer or something that develops together. But unfortunately, the majority of pancreatic cancers don't occur as a result of direct risk factors.
For patients who have pancreatic cancer, you need to be aware there are lots of support services around, and that you should not feel isolated through this journey.
For the diagnostic of this cancer, they use the CT scan, ultrasound, endoscopic ultrasound, or a marker called CA 19.9. So again, one of the ideas is that if you have a history of pancreas cancer in your family and you are 40 years and older, I would say that you should ask your doctor to, if you have any symptom, digestive symptom that is bothering you, you better check for this cancer if you have family history. There is an increase of the cancer related to metabolic syndrome. I already mentioned that insulin is a cancer promoter. Insulin increases the glucose absorption by cancer cells, and then it might activate the progression or aggressiveness of the cancer. The metabolic syndrome is it consists of 3 of these 5 symptoms: increased waist circumference more than 35 inches for female and more than 38 inches for male, triglycerides level above 150, and then blood pressure above 130/85. Some new research is showing that 120/80 is the level. Fasting blood glucose over 110, and some researchers I mentioned 100, and then HDL cholesterol lower than 40 for male and lower than 50 for female. In the Adventist Health Study 2, we have we know that this is a new study. We don't have data on pancreas cancer on that yet, but we know that for 55 years old females and males, being vegetarian decreased the weight by 30 pounds. This would be important because weight is one of the factors for pancreas cancer. And then there is a half prevalence of diabetes type 2 that is also related to pancreas cancer among vegetarians and lacto-ovo-vegetarians compared to those that are non-vegetarian. So, summarizing those causes. We say that overweight is a convincing element. Abdominal fat is a convincing element. Then a greater childhood growth, probably related to the amount of foods that we give to children, and that happens during childhood or during pregnancy, might affect the risk of pancreas cancer in adult life. Red meat, processed meats, alcohol, fructose, and saturated fats are suggestive causes of the cancer. Oh, look, Fred loved these things. Didn't Fred die last January of pancreatic cancer? So, according to the World Cancer Research Fund, there is no much evidence for fruits, regular exercise, and dried foods, and dates and raisins and legumes, but this was positive in the Adventist Health Study. So maybe we need a little more time to confirm or not these effects. We had 40 cases of pancreas cancer in the Adventist Health Study 1, and then it was found that the consumption of what was protective was the consumption of legumes, veggie meats, dates, raisins, and dried fruits. And this was responsible for 1/5 rate of pancreas cancer compared to rare or no consumption of these foods. Legumes, eating twice a week, produce a rate of 1/30 the rate of pancreas cancer with those that rarely use legumes. In the Rochester University, Dr. Paul Okuniev gave resveratrol to patients with cancer, pancreas cancer, before radiation treatment. And then it looks like there is a higher apoptosis rate for the cancer cells. And the cancer cells were doubly assaulted. So in that case, radiation plus an antioxidant, resveratrol is rich in blueberries, in grapes, and grape juice. Resveratrol is one of the dark substance that in those vegetables give the color dark or dark bluish. Those are the source of resveratrol, as well as in peanuts. And a joke, I'm not vegetarian because I love the animals. I'm vegetarian because I hate the vegetables. So I'm gonna kill the vegetables. This is by Woody Allen. Folic acid-rich foods, the main source of folic acids are the beans. But it is common also in fruits and dark green leaf vegetables. According to Dr. Rippey in the book Lifestyle Medicine, lifestyle foods also have an influence in pancreas cancer. Red meat might increase the risk, fruits and vegetables might decrease, and then garlic decrease the risk too. So we finish our lecture today with Daniel 1, verse 12 and 15. This is the story of Daniel. And then he said to the king, "Give us nothing but vegetables to eat and water to drink." Then in verse 15, at the end of the 10 days, they looked healthier and better nourished than any of the young men who ate the royal food. I don't know, and I believe we don't know very clear what was in the royal food, but I can imagine that was full of meat, sugar, and dairy, or whatever things that are rich. And then Daniel preferred to use vegetables, and drink water. And he was awarded with more health and also more mental health, and that's important. He was more nourished, and then he was wiser than the other guys when he followed this diet. So it's a challenge for us, but also is a reward that is there if you eat more vegetables in your diet. And you can prevent pancreas cancer and other forms of cancer, as we mentioned. And we finish this chapter on pancreas cancer. Thank you for your attention, and I'll see you in the next session. Bye-bye.